So hello guys, welcome to our channel Niperian Solutions. Today we are going to discuss about the pharmacology, a very important topic, that is your antimicrobial agents और the chemotherapeutic agents. आपको पता है कि ये टॉपिक कितना इंपॉर्टेंट है फ्रॉम योर जीपैट पॉइंट ऑफ व्यू, नाइपर, ड्रग इंस्पेक्टर एज वेल एज फॉर योर फार्मासिस्ट ऑल्सो. ओके, तो बहुत ही इंपॉर्टेंट टॉपिक है. ठीक है, तो जो भी इम्पोर्टेंट एमसीक्यू है वो हम आज कवर करेंगे इस टॉपिक के एंटीमाइक्रोबियल एजेंट्स. सो द फर्स्ट वन, ऑल ऑफ द फॉलोइंग ड्रग्स आर बैक्टीरिसाइडल एक्सेप्ट. सो व्हाट दे आर आस्किंग, बैक्टीरिसाइडल एक्सेप्ट मीन्स दे आर आस्किंग द बैक्टीरियोस्टैटिक ड्रग अमंग द फॉलोइंग ऑप्शंस. सो व्हाट आर द ऑप्शंस? द ऑप्शंस आर आइसोनियाजिड, tigecycline, daptomycin and ciprofloxacin. Okay, so what is the correct answer here? That is your tigecycline. Okay, this one, tigecycline is the correct answer. So what are the other options? Isoniazid, daptomycin and ciprofloxacin. So we know that isoniazid is active against your tuberculosis, right, and ciprofloxacin it is a fluoroquinolones. So these all the other drugs like isoniazid, daptomycin and ciprofloxacin are the bactericidal. Only tigecycline is the static one, bacteriostatic. That is the cyclyl glycine from your tetracyclines. Okay, so tigecycline is the answer of our question. So what about isoniazid? Isoniazid is an anti-tubercular agent. That is the first line anti-tubercular agent. What are the other like anti-tubercular agent which are in the first line? Okay, so that is also very important. So the first line anti-tubercular drugs, so please remember this one. Okay, that is the price. Okay, so this one is the pyrazinamide, very important topic here, anti-tubercular agents. This is R is rifampin or rifampicin, then I is for our isoniazid. Okay, then streptomycin and E is your ethambutal, right? So these all are the example of your first line anti-tubercular agents. Okay, so what are the other important points regarding the same? Your ethambutal is the only first line anti-tubercular agent that is static in nature. Okay, what? Static in nature. All these four options, okay, pyrazinamide, rifampicin, isoniazid and streptomycin, these are all are the cidal in nature. That is very very important. Okay, another point, that is your streptomycin and the ethambutal, the only two drugs from the first line, these are not hepatotoxic. Okay, streptomycin and ethambutal are not hepatotoxic. Remaining are pyrazinamide, rifampicin and isoniazid. These three, these are very hepatotoxic in nature. So that is very important point from your anti-tubercular agents. Okay, so the next, okay, here are the list of your bacteriostatic and bactericidal drugs. So please go through it because this is very important question from your general consideration of your chemotherapy. So in protein synthesis inhibitors, in your protein synthesis inhibitors, so these are the drugs are the bacteriostatic, and the only aminoglycosides and streptogramins, these are your bactericidal. So what about streptogramins? So what are the example of streptogramins? So these are nothing but your dalprostine, quinpristine. So these are the example of your streptogramins. Then another drug affecting DNA. So please remember the bacteriostatic one and bactericidal one. Then drug affecting metabolism, that is your sulfonamide, dapsone, para-aminosalicylic acid, trimethoprim, ethambutal. These are your bacteriostatic. If you know the like trimethoprim and sulfonamide, right? These two drugs. Which one? Trimethoprim and sulfonamide. So alone these drugs are the bacteriostatic in nature, right? So both the drugs are bacteriostatic alone, but the combination of trimethoprim and sulfonamides, that is sulfomethoxazole, that is known as your cotrimoxazole. but that is your bactericidal. So trimethoprim alone, it is a bacteriostatic. Sulfamethoxazole alone, that is your also bacteriostatic. But the combination, if you are combining sulfamethoxazole plus trimethoprim, so the combination is your bactericidal. Okay, so please remember this point. Done. Again, here are some important polypeptide antibiotics. Here are the polypeptide antibiotics, cell wall synthesis inhibitors, and the first line anti-tubercular agents. So just we have seen this point. The first line anti-tubercular agents, so ethambutol is only ethambutol is only the bacteriostatic, other all are the bactericidal. Okay, so the next one, which of the following antibiotics acts by inhibiting cell wall synthesis? Again the question from your cell wall synthesis inhibitors. Okay, so we know, so what are the drugs which inhibit the cell wall? So these are your like fosfomycin, okay, then beta lactam antibiotics, then your bacitracin, right, then cycloserine, and your vancomycin, right. So these are the drugs which are mainly inhibit the cell wall. The mechanism of action of these drugs are the cell wall synthesis inhibitor. Now we are going to see what are the options. So options are, first one, okay, so the first option is your cefepime, then aminoglycosides, erythromycin, and doxycycline. Okay, so we know cefepime, what it is, that is the cephalosporins, and that is nothing but your beta lactam antibiotic. Okay, so beta lactam antibiotic is cell wall synthesis inhibitor, means the correct answer is your cefepime only. But what about the other options? Aminoglycosides, erythromycin, and doxycycline. Okay, so aminoglycosides, so what are the example of aminoglycosides? Just that is your streptomycin. Okay, so we know these are the your protein synthesis inhibitors, right? Okay, protein synthesis inhibitors. Then erythromycin, that is from your macrolide category. Okay, and doxycycline, again it is from your tetracyclines. So option number A is the correct, because only cephalosporin are the cell wall synthesis inhibitors. Okay, here are the cell wall synthesis inhibitors, just we have seen. Okay, so the fosfomycin, beta lactam antibiotics, bacitracin, cycloserine, and vancomycin, these are our cell wall synthesis inhibitors. But specifically which enzyme they are inhibiting? Okay, so fosfomycin inhibit the enol pyruvate transferase, beta lactam antibiotics transpeptidase. Okay, what are the like examples of your beta lactam antibiotics? Okay, so these are your penicillins, then cephalosporins, then carbapinams, monobactams. Okay, PCCM, these are the examples of your beta lactam antibiotics, and these inhibit your transpeptidase enzyme. Okay, then bacitracin, this is the dephosphorylation of bactoprenol. Then cycloserine, this is the that ending sequence of D-ALA, right, alanine racemase and alanine ligase, that is also very important. And the vancomycin, that is the transglycosilase, right. So please don't get confused between your cycloserine and your beta lactam antibiotics, right, because in beta lactam antibiotics penicillin, that is also acting on your D-ALA, but it inhibits the enzyme transpeptidase, and here cycloserine, they are inhibiting the alanine racemase and alanine ligase. Okay, so these are the examples of your cell wall synthesis inhibitors. Okay, the next one, which antibiotic acts by inhibiting protein synthesis? Okay, so what are the options? C4010, doxycycline, ciprofloxacin, and oxacillin, right. So C4010, again C4010 is your cephalosporins, right, means this is your beta lactam antibiotic. Okay, then doxycycline, that is from your tetracyclines. Done. Ciprofloxacin again fluoroquinolones, and oxacillin is your penicillin. ओके तो अभी आपको देखना है कि कौन से प्रोटीन सिंथेसिस इनिबिटर्स है. तो जस्ट अभी हमने देखा कि सेल वॉल सिंथेसिस इनिबिटर्स आर द बीटा लैक्टम एंटीबायोटिक्स. सो सिफेलोस्पोरिन इज योर सेल वॉल सिंथेसिस इनिबिटर as well as your penicillin, that is also a cell wall synthesis inhibitor. Okay, and what about ciprofloxacin? Ciprofloxacin are the fluoroquinolones, okay, and which inhibit your DNA gyrase. Okay, which enzyme? DNA gyrase. So what is the correct answer here? That is your doxycycline. Okay, means doxycycline, or this is the type of your tetracycline, that is the protein synthesis inhibitor. Other C4010, ciprofloxacin and oxacillin, these are not a protein synthesis inhibitors. Okay, C4010 and oxacillin are the your cell wall synthesis inhibitor, while ciprofloxacin is your DNA gyrase inhibitor. Correct. So the next one, okay, here are the some classification based on your mechanism of action. Okay, if you are seeing here, cell wall synthesis inhibitors like beta lactam antibiotics, vancomycin, cycloserine and bacitracin. So please remember these all the drugs. Okay, then again cell membrane leakage, polymyxin B, colistin and amphotericin B. Okay, then protein synthesis inhibitors, tetracyclines, chloramphenicol, macrolides, clindamycin and linezolid. Okay, then misreading of mRNA, these are your aminoglycosides, right? And DNA gyrase inhibitors, just we have seen the DNA gyrase inhibitors, that is your fluoroquinolones. One another example, that is a novobiosine, that also inhibit your DNA gyrase enzyme. And the interfere with DNA function, right? That is your rifampicin. So which enzyme it inhibit? That is the DNA dependent RNA polymerase. What it is? DNA dependent RNA polymerase. So rifampin inhibit this enzyme, DNA dependent RNA polymerase. Okay, so here are some other options, interfere with mediatory functions. Okay, so these all are the classification based on your mechanism of action. Okay, so the next one, एंटीमाइक्रोबियल एजेंट एक्टिंग बाय इनिबिशन ऑफ सेल वॉल सिंथेसिस, ये तो हमने अभी देखा था. ठीक है, इरिथ्रोमाइसिन, टेट्रासाइक्लिन्स, लोमीफ्लोक्सेसिन एंड सिफेपाइम. ठीक है, तो इरिथ्रोमाइसिन दैट इज योर, ओके, सो इरिथ्रोमाइसिन इज योर मैक्रोलिड एंटीबायोटिक. डन. टेट्रासाइक्लिन्स, लोमीफ्लोक्सेसिन is your fluoroquinolones and cefepime. Okay, so we know the erythromycin, tetracycline, these are your protein synthesis inhibitors. Okay, so these two drugs, so these are your protein synthesis inhibitors. Done. What about lomeofloxacin? That is your DNA gyrase inhibitor. Okay, means what is the correct answer? That is your cefepime. Cefepime is nothing but your the cephalosporins or your beta lactam antibiotics, and we know the beta lactam antibiotics, these are the cell wall synthesis inhibitors. So that's why the correct answer is cefepime. Done. Okay, the next, all of the following antibacterial agents act by inhibiting cell wall synthesis except. Again the same question. Carbapenems, monobactams, cephalosporins and nitrofurantoin. ठीक है, अभी हमें पता है कि कार्बापेनम्स आर नथिंग बट योर बीटा लैक्टम एंटीबायोटिक्स. मोनोबैक्टम, this is also a name itself indicate, bactam means this is the beta lactam. What is the example of monobactam? That is aztreonam. Okay, cephalosporins, this is also a beta lactam antibiotic. So what is remaining? That is your nitrofurantoin, and that is our correct answer. Okay, so So all are bacterial agents inhibiting the cell wall synthesis except nitrofurantoin. Okay, the next question. All of the following drugs act on the cell membrane except. This is also very important question. So the options are nystatin, griseofulvin, amphotericin B and polymyxin B. Okay, so we know, so if you are looking to the options, so these are all the options from your antifungal agents. Okay, which topic? Antifungal agents. So the nystatin, griseofulvin, amphotericin B and polymyxin B. Okay, so polymyxin B is your polypeptide antibiotic. Okay, then amphotericin B is your polyiin antibiotic. Nystatin is also your polyiin antibiotic, and griseofulvin is nothing but your spiro compound. Okay, this is the spiro compound. So what is the correct answer here? So the drugs act on the cell membrane except. So nystatin, obviously it is acting on the cell membrane. Amphotericin B is also cell membrane, and polymyxin B is also acting on your cell membrane. So that's why the correct answer is your griseofulvin. Okay, because griseofulvin is a spiro compound, right? And what is the mechanism of action? Griseofulvin, that is the microtubule damaging. Okay, arrest in the metaphase. Okay, so griseofulvin is the compound from antifungal agents, that's the spiro compound, and acts on the microtubule damaging type of mechanism of action. So that's why griseofulvin is the correct answer. Okay, the next one, bacitracin acts on, very simple question, the cell wall, cell membrane, nucleic acid and ribosomes. So what is the correct answer? That is your cell wall. ठीक है, हमने देखा था bacitracin, उसमें था ना bacitracin, your beta-lactam antibiotics, fosfomycin, these are the cell wall synthesis inhibitors. So here correct answer is your cell wall. Okay, the next, all of the following antibiotics acts by interfering with cell wall formation except. Again the same question. So most of the questions are from the cell wall synthesis inhibitors. So ceftriaxone, that is the cephalosporin, that is the beta-lactam antibiotic. Vancomycin, we know that is also the cell wall inhibitors. Cycloserine is also cell wall synthesis inhibitors, right? And the clindamycin. So what is the correct answer? That is your clindamycin. Okay, the next, which of the following drug is bactericidal? So previously also we have seen the one question regarding the bacteriostatic and the bactericidal. So sulfonamides, we know the sulfonamides are the bacteriostatic in nature. Erythromycin, chloramphenicol and cotrimoxazole. So erythromycin, that is the macrolide antibiotic, and we know the macrolide antibiotics are the bacteriostatic in nature. Chloramphenicol, that is also bacteriostatic in nature. Cotrimoxazole, this option also we have discussed before. Okay, cotrimoxazole, so that is our answer, that is the bactericidal. So cotrimazole or cotrimoxazole, that is the combination of your trimethoprim and your sulfonamide sulfamethoxazole, right? That is your sulfamethoxazole. And these individual drugs are static in nature. This is also static and this is also static, but the combination of these two this is the cidal in nature. Okay, so very important. Okay, here are the list of bacteriostatic and bactericidal. Previously also we have seen according to like static or the cidal effect. So please go through it once. Okay, the next one, which of the following is a broad spectrum antibiotic? Here is again the classification like your broad or the narrow spectrum. Broad or the narrow spectrum. So erythromycin, streptomycin, tetracycline and all of the above. So what is the correct answer? We know the broad spectrum So that is the our tetracycline. Okay, so the correct answer is your tetracycline, because tetracycline and chloramphenicol, these are the broad spectrum antibiotic, while erythromycin and the streptomycin, these are the narrow spectrum antibiotics. Okay, so that's why here tetracycline is the answer. Okay, here are the spectrum of activity. So here you can see that your streptomycin and the erythromycin, these are the narrow spectrum, while tetracycline and the chloramphenicol are the broad spectrum of antibiotics. So that table is also very important, spectrum of activity. Okay, the next question, which of the following antibiotic does not act by inhibiting protein synthesis? तो उन्होंने पूछा है कि इसमें से कौन सी एंटीबायोटिक ऐसी है जो कि प्रोटीन सिंथेसिस को इनहिबिट नहीं करती है. ठीक है, डज नॉट. वैंकोमाइसिन. सो व्हाट इज वैंकोमाइसिन? वी नो दैट इज द सेल वॉल सिंथेसिस इनहिबिटर. टेट्रासाइक्लिन, it is protein synthesis inhibitor. Streptomycin, that is also your aminoglycosides, and again these are the protein synthesis inhibitors. And azithromycin, that is nothing but your macrolide antibiotic, and these are again the protein synthesis inhibitors. Okay, so it means these three are the protein synthesis inhibitors, and vancomycin is the cell wall synthesis inhibitor. So what is the correct answer? That is your vancomycin. So these are the important question from your chemotherapy or the antimicrobial agents, the general consideration. Okay, so here are some important points regarding the your antimicrobial agents. So this question is also many times they are asking in the exam. Okay, so antimicrobials producing the hemolysis in glucose 6-phosphate dehydrogenase deficient patient. So कौन से ड्रग है जो कि hemolysis प्रोड्यूस करते हैं in the glucose 6-phosphate dehydrogenase deficient patients? So the primaquine, chloroquine, quinine, chloramphenicol, nitrofurantoin, fluoroquinolones, dapsone and sulfonamides. So what is dapsone? Okay, so dapsone, right, पढ़ा है ना ये हमने dapsone. So dapsone is anti-leprotic drug. Okay, that is again the sulfonamide, but specifically that is the active against the leprosy. Okay, primaquine, chloroquine, right, even quinine, these are used in the malaria. Chloramphenicol and nitrofurantoin, fluoroquinolones. Okay, so these are again, chloramphenicol is your broad spectrum antibiotic. Nitrofurantoin, this is generally used in your urinary tract infection. Okay, and fluoroquinolones, these are again the like major group, right, they are the inhibitors of your DNA gyrase, right. So please remember these drugs, right, because these producing the hemolysis in glucose 6-phosphate dehydrogenase deficient patient. Okay, here is one important table, the favorable urinary pH for your antimicrobial action. Okay, so which drug are active in acidic medium and which drug is active in your alkaline medium. Okay, so the nitrofurantoin, methenamine, tetracyclines and cloxacillin, these are active in acidic pH, while in cotrimoxazole, cephalosporin, fluoroquinolones and aminoglycosides, these are active in alkaline pH. One another antitubercular drug which is active in acidic pH, right. So what is this? So please answer this one in the comments. So which acidic drug from your antitubercular agents, so which is active in acidic pH? The pH is also around like 5.5. so please name the drug in your comments. Okay, that is also very important. Natural source of antibiotics. So what are the different natural sources? So these are the fungi, bacteria and actinomycetes. So your penicillin, griseofulvin and cephalosporins, these are obtained from the fungi. Then polymyxin B, thyrothrycin, colistin, aztreonam, bacitracin, these are from your bacteria. And your aminoglycosides, macrolides, tetracyclines and polyenes and chloramphenicol. These are from your actinomycetes. So these are very important points from your chemotherapeutic agents, because many times in exam they are asking the question from here only, because this topic is a summary of your all the antimicrobial agents. Okay, so that's why this first topic, the general consideration, is very very important. Okay, so please go through it once. So thank you guys. So what are the other topics that we are covering in the next lecture? So from the chemotherapy, okay, so these are your like beta lactam antibiotics, right? Then after that your antifungal agents, then antitubercular drugs, then antileprotic drugs, okay, then antiviral agents, anti-cancer agents, right? So there are very vast category like macrolide antibiotics, aminoglycoside antibiotics, then urinary antiseptics. There are many like drugs or many subtopics in your chemotherapy. So please go through it. हम भी एक एक करके हम सब कवर करने वाले हैं. जितने भी इंपॉर्टेंट एमसीक्यू होंगे उस टॉपिक में से हम सब कवर करेंगे. ठीक है, तो जितना भी केमोथेरेपी का पोर्शन है और जो भी फार्माकोलॉजी का जो भी इम्पोर्टेंट पोर्शन है वो हम सब कवर करेंगे. अभी आपकी जो भी एग्ज़ाम्स आ रही है, राइट, सो दैट इंक्लूड्स that one is your like RRB pharmacist. So pharmacology is the very major subject for your RRB pharmacist. Okay, again in AIMS, right, even your GPAT, your DI, right? So in all the exams from your pharmacology this session is very important, like antimicrobial agents. तो आपको सभी जितने भी टॉपिक्स है इसमें आपको सब एक एक करके पढ़ने हैं. आपको थोड़ा कंपेरेटिवली स्टडी करना पड़ेगा. ठीक है, so depending on the exam, like for RRB we will like superficially we have to go for the classification or the what is the mechanism of action, what are the adverse effect, right? And for your GPAT exam or your in drug inspector exam, so some chemistry part is also involved. Okay, so you have to go simultaneously with pharmacology and for your medicinal chemistry also. Okay, so for pharmacology there are two books are very important. So as we all know, so first one is your KD Tripathi. Okay, so the first one is your KDT and then your Gupta and Garg, right? So these two books are more than sufficient for your pharmacology. आपको कोई भी दूसरा बुक पढ़ने की ज़रूरत नहीं है. फिर आप बोलोगे कि नहीं सर हमें रंग एंड डेल पढ़ना है, नहीं सर हमें लिपिन कोट पढ़ना है. ठीक है, अगर आप ये दो बुक पढ़ लेते हो ना, ठीक है, गुप्ता एंड गर्ग एंड केडी त्रिपाठी, तो आपको कोई भी और बुक पढ़ने की ज़रूरत नहीं है, क्योंकि जितना भी मेजर पोर्शन है बस आपको ये दो बुक पढ़ना है. ठीक है, गुप्ता एंड गर्ग, because in KD Tripathi and Gupta and Garg is very very important, because they have given like comparative study or the important tables, key features and all the things and the MCQs, that all the things they have given in your Gupta and Garg book. तो आपको कोई भी ये बस दो बुक पढ़ना है फार्माकोलॉजी के लिए, इसमें से कुछ भी स्किप नहीं करना है. ठीक है, तो बाकी आप पढ़ो या ना पढ़ो तो और अच्छा है, बट अगर आप नहीं भी पढ़ोगे तो भी चलेगा. बट KDT and Gupta and Garg, these are very important books for your pharmacology. So thank you guys. So in the next lecture we will see the another topic from your chemotherapy. So आप भी सजेस्ट करिए कि आपको कौन से टॉपिक्स इंपॉर्टेंट है वो हम कवर करेंगे, या फिर अगर आपकी एग्ज़ाम आ रही है तो दीज आर द टॉपिक्स दैट यू आर नॉट गोइंग टू कवर्ड प्रीवियसली, तो वो भी हम कवर कर लेंगे. ठीक है, आप कमेंट्स करके बताइए कि आपको कौन से टॉपिक्स इंपॉर्टेंट है या फिर हमें कौन से कवर करने चाहिए. Accordingly we will go and we will do the study. Okay, so thank you so much guys, thank you so much.